My name is Xavier Thomas, and this is my video assignment for kinesiology's first aid course towards treating and bandaging a wound. For the example I've chosen a semi-deep laceration to the leg. Now, before I begin treatment, I have to observe the situation. I can see, hey, there's a laceration here on the leg. As far as I know, the patient is conscious and they've just given me consent in order to go about treatment. Now, before I do begin treatment, I have to ensure that there is safety between both me and the patient in the form of some sort of a barrier, and for that reason I have some black medical examination gloves, specifically latex-free, as that is the current standard. Now, to begin, I have to apply pressure to the wound until the bleeding stops. And for that, I've got some non-stick gauze pads, which will also be used in the bandaging process. So for this, I'm applying direct pressure to ensure that the bleeding is able to be removed and that it can stop, as it will adhere to the, alright? As far as I know, the bleeding stopped. So now I'm going to go about cleaning it. I'm using 90% isopropyl alcohol, peroxide, not isopropyl, peroxide for this. I'm only going to use it once, as I don't want to damage any of the good skin. And this is just purely until treatment can be completed. I'm going to go about grabbing my next pad. And I'm going to go about bandaging. For this, I'm going to be using the spiral method. So with my bandage, I'm going to first secure it. Ensuring there's some pressure. And then I'm going to alternate. Ensuring that the wrapping is tight, I'm now going to ensure that it is secured using some cloth tape. And with that, the patient is now stabilized enough to seek proper medical attention, and my job is done. Now, afterwards, I have to ensure that I dispose of these correctly. It seems I forgot to grab the bag in preparation. As I do not have any Ziplocs on hand, I'm going to use the double bagging method. But first I have to remove my gloves. For that, I pinch the wrists. And I dispose of them. All right, you can cut.